Hey everyone. So the topic we selected for our EBP project is Purewicks versus indwelling urinary catheters and the prevention of catheter-associated urinary tract infections. Members of my team include myself, Dominic Lim, Melissa Gonzalez, Myra Martin Del Campo, and Anna Salazar. Our PICO question is, in hospitalized female patients in the ICU, does the use of external urinary catheters such as Purewicks compared to indwelling catheters decrease CAUTI during their hospital stay? This topic is an important issue to investigate because CAUTIs are the most common types of healthcare-associated infections and can occur when an indwelling urinary catheter is inserted through the urethra for the use of managing urine output or urinary retention. Once placed into the bladder, microorganisms can colonize the catheter and therefore cause an infection of the urinary tract. CAUTI risk factors include the prolonged use of indwelling urinary catheters, age, and are most common in female patients. If CAUTI is left untreated, bacteria can enter the bloodstream and cause bacteremia, sepsis, and even death. The concern about the practice of indwelling urinary catheters is that when it is used inappropriately, not managed according to clinical guidelines, and left in place for a prolonged amount of time although it is no longer indicated, CAUTI will most likely occur. CAUTI increases the length of hospital stay as well as costs, with the cost of one CAUTI that was recently estimated to be over $10,000 for a patient in an intensive care unit. In one quality improvement project from the Journal of Wound, Ostomy, and Continence Nursing, the purpose of the study was to find the reduction risks of CAUTI in female patients by implementing the Purewicks device as an alternative to indwelling catheters. This was a level 4 evidence because it was a non-experimental design and the variables could not be manipulated. Baseline data was used from previous studies instead. Their aim was to determine whether the introduction of Purewicks benefit female patients and prevent CAUTI cases. After using baseline data from previous years from 2015 to 2017, this study had strong evidence as researchers were able to conclude that the use of Purewicks reduced indwelling catheter utilization days over a 2-year period, which in return reduced the risk for CAUTI. Prior to the introduction of the Purewicks device in 2015, the utilization rate of female indwelling catheters was 31.7%, and the female CAUTI rate was 1.11 per 1,000 days. After the introduction of the Purewicks, both rates declined. In 2016, the indwelling catheter utilization rate was 29.7% and the CAUTI rate was 0%. In 2017, the indwelling catheter utilization rate was 26% and the CAUTI rate was 0.90%, which was not significantly different to the prior year rate in 2016. However, there were limitations as data collection tools were not set up on time to collect the number of days Purewicks were used. Data was instead relied on the purchasing department to determine the use of Purewicks. In a retrospective observational study from the National Center for Biotechnology Information, the purpose of their study was to investigate the effect of Purewicks on indwelling catheter use and CAUTI rates in females. This too was a level 4 evidence in which they used data from previous years. They compared CAUTI rates in female ICU patients in the year before January 1, 2017 to December 31, 2017, and 2 years after January 1, 2018 to December 31, 2019, when the Purewicks devices became available at the Thomas Jefferson University Hospital. After thorough comparison, there was strong evidence to support our PICO question, as researchers concluded that the introduction of Purewicks were associated with a statistically significant reduction in CAUTI rates among female ICU patients. A yearly breakdown showed a continued downward trend, with a CAUTI rate of 1.68 in the first post-intervention year and a rate of 1.17 in the second post-intervention year. There was an 18.2% decrease in ICU female indwelling catheter days from an average of 610 monthly device days to 499.
In a case study found in 2016, the purpose of the case study was to evaluate the ease and effectiveness of the use of the Purewicks for female urinary incontinence in bedbound women. This study was also a level 4 evidence. The Purewicks was used for 16 bedbound females for 1,843 days, and out of those 16 patients, the 14 said that Purewicks were easy to use, had no discomfort, and there were no cases found to have caused a urinary tract infection. There were also no cases of cystitis that occurred, and only one occurrence of bacteremia was present. Evaluation of proper fitting and effectiveness of the Purewicks resulted in 95 to 99%. After gathering surveys about experiences from the patients and caregivers, the Purewicks system was found to be effective, easy to use, and comfortable in managing urinary incontinence. In a retrospective observational study from the Critical Care Medicine Journal, the purpose of the study was to find an alternative to internal urinary catheters and reduce indwelling catheter days and infection rates amongst patients in the medical ICU. A care bundle was implemented consisting of a daily review of indwelling urinary catheter necessity, increasing awareness of higher risk catheters, and utilization of external urinary catheters. The study was observed over a 40-month period in a 20-bedded medical ICU at a tertiary hospital. A total of 19,977 patient days were reviewed over that 40-month period. Pre-implementation of the bundle, the medical ICU had 9,830 patient days, 6,928 internal urinary catheter days, and 16 CAUTIs, meaning that there was a urinary catheter utilization rate of 70.5 and a CAUTI rate of 2.3%. Post-implementation of the bundle resulted in 10,147 patient days, 6,507 internal urinary catheter days, and 6 CAUTIs, meaning that there was an indwelling urinary catheter utilization rate of 64.1 and a CAUTI rate of 0.9%. Overall, the study showed a decrease in CAUTI rates with the implementation of the Purewicks in a medical ICU.
Study 5. From the American Journal of Infection Control, a retrospective study was performed with the purpose to analyze and determine if female external urinary catheters were associated with a reduction rate of CAUTIs in female patients. The study is a level 3 evidence and took place in an acute care facility. Participants were of age 18 and over, requiring urinary management or were on a strict intake and output monitoring. Data was collected from March 2016 to May 2018 via a retrospective chart review and electronic medical records. The study was divided into 3 phases: the pre-implementation of female external urinary catheters, the introduction of female external urinary catheters, and the post-implementation of female external urinary catheters. The study found a decrease in CAUTI rates post-implementation and recommends an implementation of female external urinary catheters in the facility, preferably to begin in the ICU to decrease the rates of CAUTIs. Study 6. In a study from the Journal of Emergency Nursing, a clinical implementation project using the Plan, Do, Check, Act framework was performed to implement the use of female external urinary catheters in the emergency department with the purpose to view if a decrease of CAUTIs is associated with female external urinary catheters. The study is both a level of evidence 2 and 3. The data was collected using the retrospective method. The criteria to be included in the study were as followed: female patient, non-critical conditions, does not require intake and output monitoring, age 18 and above, alert and oriented with a history of urinary incontinence or immobility. The setting was a 451-bed magnet community hospital in the southeast United States. A total of 187 female external urinary catheters were placed within a 3-month period. After implementation of the female external urinary catheters, the hospital decreased overall insertion of indwelling urinary catheters from 738 to 429. The study further states the rate of CAUTIs decreased, however did not specify a number.
The Journal of Wound, Ostomy, and Continence Nursing conducted a quality improvement project at Boston Medical Center, a 487-bed hospital between 2013 and 2017. This study was a level 4, and the purpose of this study was to reduce catheter-associated urinary tract infections in critical units using a bundled care model in the span of 4 years. Their approach was done in a sequential order, specifically in a plan, do, study, act cycle, starting with 5 interventions that were easily adaptable and most likely to decrease CAUTI rates. The 5 interventions were process for insertion and maintenance of Foley catheters, indications for indwelling Foley catheters, appropriate testing for CAUTIs, alternatives to indwelling devices, and sterilization techniques. A standard run chart was first utilized and then was switched to statistical process control data once there were sufficient number of data points. The total number of CAUTIs at BMC decreased from 53 in 2013 to 9 in 2017. The 83% reduction occurred because of the implementation of the 5 interventions. The data plotted showed a significant decrease due to awareness campaigns, newer insertion, maintenance protocols, bladder management protocols, implementation of Purewicks, and CHG bathing protocol. So the British Medical Journal conducted 3 different case studies to explore the use of external urinary collection devices after the indwelling urinary catheter was removed, and to observe the management of urinary incontinence. This article was a level 4 because it was a case study format. The 3 case studies did not include the location of the hospital or unit. And also this article didn't have the clear form of measurement of data used. So all 3 patients had extensive medical history, had urinary incontinence problems, and used an external catheter option during their hospital stay. For case study 1, the 45-year-old woman was offered the female external urine collection device and was able to sleep better, and this promoted faster recovery of her septic episode. She continued to request the device with each readmission. For the second case study, the 62-year-old woman was given an external catheter, and her condition improved and allowed for her to rest and avoid adverse skin injuries. The last case study, the 70-year-old woman did have an indwelling catheter in place due to increased fecal incontinence. However, once the indwelling catheter was not needed, an alternative external female collection device was requested. This ended up helping with preventing future wound injury. Patients also reported a sense of cleanliness, increased comfort, and less frequent linen change. And there weren't any CAUTIs reported in either of the 3 case studies with the use of the female external catheter. So the collective findings for all of our studies demonstrated that the use of Purewicks as an alternative for indwelling urinary catheters, if appropriate, is an effective way of reducing CAUTI rates in female patients. Although most of our studies selected were not at the top of the pyramid in the level of evidence hierarchy, each demonstrated valid scientific evidence from other study reviews related to the use of Purewicks and the reduction of CAUTI rates. So in other words, since most were non-experimental designs, baseline data was instead gathered from previous years to determine whether Purewicks were effective alternative devices in decreasing CAUTI compared to indwelling urinary catheters. So they used data-proven CAUTI reduction techniques based on current best practice, guidelines, table and chart reviews, process maps to perform gap analysis, PDSA cycles, and monitored the effects of the interventions. Overall, our studies safely concluded that the use of female external urinary catheters are a viable intervention in reducing indwelling urinary catheter utilization and CAUTI rates.
Recommendations for clinical practice. So Purewicks are meant to be for patients that require urine output monitoring but do not meet the indications for indwelling Foleys. For example, some patients would be patients who are bedbound or are on strict bed rest, patients who have difficulty using a bedpan or walking to and from the toilet, patients who are post-surgical or have procedure immobility, and patients with skin injuries or irritation related to urinary incontinence or diapers. Some contraindications for use of the Purewick include urinary retention, latex sensitivity or allergy, vaginal bleeding, uncooperative or agitated patients, male patients, and patients who get out of bed without supervision or are on a commode at the same time. So some recommendations for the patient would be to do perineal care prior to the insertion of the Purewick, to properly assess skin integrity prior to the Purewick placement, and also to assess the skin every 2 hours after the Purewick is in place. As far as usage of Purewicks, it's recommended to have it on continuous low wall suction of a rate of 40, but it's not to be to exceed 80. We also recommend verifying the placement of the Purewick every 2 hours, replacing the Purewick at least every 8 to 12 hours or sooner if the patient is soiled with blood or feces, and also to replace the canister and the tubing every 60 days or sooner if there's signs of degradation. We also recommend providing proper education to all clinical staff, which include not only the nurses but all healthcare providers. Some other members that would benefit from this education would include patients themselves that are coherent, nursing assistants, nurse practitioners, physicians, physician assistants, and residents.
To summarize our PowerPoint presentation, first I'll start by restating our PICO question. In hospitalized female patients in the intensive care unit, does the use of female external urinary catheters compared to indwelling catheters decrease catheter-associated urinary tract infections during their hospital stay? Our research findings show the use of female external urinary catheters such as Purewicks proved to have a direct decrease of CAUTIs when used instead of indwelling catheters. The clinical practice guidelines ensure the use of female external urinary catheters as a safe and effective, non-invasive alternative for urinary management while reducing the risk of CAUTIs. To conclude, the answer to our PICO question is yes. In hospitalized female patients in the intensive care unit, the use of female external urinary catheters compared to indwelling catheters decreases catheter-associated urinary tract infections during hospital stay. Thank you.